I am Shana Palmieri. I'm the Chief Clinical Officer for XFERALL and one of the co-founders. By background, I am a clinical social worker and have spent my career in healthcare administration. Spent years in emergency departments, working with emergency psychiatric teams, and also the issue around psychiatric boarding, ED capacity, and emergency department throughput. So we're looking at potential budget changes in healthcare. These are very unclear at this time what these will be. The most recent bill that was passed was the Full Year Continuing Appropriations and Extension Act 2025. So what we really saw there was not specific changes yet. That will be to come and it will be determined. There is some indication that there will be changes to the budget and how services and budgeting is done around Medicaid services. We did see within this act that there is $13 billion of cuts that we're looking at. Some of that may be around Medicaid. And so when we're looking specifically at behavioral health, we can talk a little bit about how this may impact behavioral health patients, also the service delivery. Medicaid funds are very critical to the provision of services for the behavioral health population. What we do see is that a higher percentage of patients who have SMIs, serious mental health conditions, so your conditions that really meet the criteria, conditions like psychotic disorders, maybe severe bipolar disorder, these types of conditions may render more of that patient population to have and be leaning on Medicaid for a lot of the services that are provided. This patient population is leaning on a lot of different types of services through Medicaid today. The states provide preventative services. So these are services that we may look at that prevent the highest level of care or prevent the patients from going into crisis and accessing emergency department room stays or inpatient level of care stays. So what's going to be very important for states to take a look at as we see what these shifts may or may not be as we move forward is how are states going to be able to take a look at how to continue and enhancing the ability to keep patients in their community-based care. So what's really important is that we really look at how can we do this smartly with the resources available and more efficiently so we can really make sure that patients can continue to get early intervention, can get good access to care. We really have to take a look at how are we getting patients from point A to point B, what resources are available, and how do we really maximize understanding what these networks and continuum of care is that's available for patients, so that we can quickly get patients to the right level of care as quickly as possible and mitigate an unnecessary use of resources. So regardless of the changes that may happen with the budget, the change is happening sort of organically that the behavioral health system needs to really look at opportunities to reach patients in a really effective way. When we look back at why XFERALL was founded by myself and my co-founding business partners, it was really this. It is to create a nationwide network where behavioral health patients can have access to care quickly. Healthcare providers can stop making phone calls and sending faxes and engaging in a process that has a lot of administrative delays and burdens for teams and create a really efficient way to help patients who are in crisis or need to be transferred along the continuum of care access the care that they need very quickly and move through that system. Regardless of what happens in the future, XFERALL is here to work with community behavioral health organizations, healthcare systems, behavioral health providers, hospitals, different systems of care to make sure that we continue on a journey to create a system where patients can get the care that they need and that we can create systems that are cost effective and provide a high quality of care. We can create systems where staff are engaging in the clinical work that they need to be and reducing administrative burden, and also creating systems where we continue to innovate and advance through the use of real-time technology to understand where can we improve tomorrow to create a better system? Where are the patients who have the greatest needs? Where are their capacity issues? And to continue to decrease the amount of time it takes for a patient to get from point A to point B to get the care that they need, so that they can, in that greatest time of need, not have to wait in accessing that care.